Hi guys, it's a quick video on dealing with uncertainty in the CSA. It's a horrible thing to deal with, both when we're preparing, we're thinking, what if I get a case that I don't know anything about? What if something comes up that I've never heard of? And also it's very stressful in the middle of a case if you don't know what this diagnosis is, for example. What am I going to do in management? What I'm going to talk about? I don't know anything about this situation. I failed the case already. Why are we doing this video? Two reasons. Number one, it's requested quite a lot in our courses, and secondly, we did a couple of social media polls recently and this came up on top. Now I'm Aman, I'm a GP and a medical educator, and I'll give you a couple of key tips to deal with this constant fear of uncertainty. Let's get started. So the first thing we're going to talk about, well, it's two things really. Number one, honesty, and number two, knowing where to go for help. Now, uncertainty is going to happen in this exam. There's going to be certain things that you don't know that maybe someone else knows, or certain things that perhaps no one knows on that particular day. Now, this is what happens in real life. As a GP, there are certain things that we don't know. My colleagues might know something, a specialist might know something, I have no idea, but that shouldn't let it faze you. The first thing that you're looking out for is honesty. Now, is this person going to blag their way through a situation that they clearly don't understand? Or is someone going to be honest and say, you know what, Mrs. X, this is not something that I come across every day. I've got a fair idea as to what's going on here, but I'm not 100% sure. You know, uncertainty comes in many different forms. What's the diagnosis here in the first place? If you know the diagnosis, what's the management that's most usual for this particular situation? What do the latest guidelines say? Is it this drug or is it this drug? Was this on that referral criteria for this problem, or was it not on the referral criteria? It might be something nothing to do with medicine. If someone comes and says, doctor, I need to get a bus pass. How do I do that? Or doctor, I've had this condition. Am I allowed to drive now? Someone mentioned that I might not be able to. Now, you might not know the answer to these things. But remember, you're not going to be the only one who doesn't know the answer. And remember also, they're not looking for excellence. You're not supposed to know the answer to every single thing that walks into your room when you're a GP. If that was the case, if we were supposed to be superheroes who knew everything about everything, then what's the point of specialists? What's the point of other specialities where things can be looked up and asked about? So number one, be honest. Again, this is not something I come across every day. You may know a lot more than this than me, having looked at it on the internet recently. But you know what? There's a few things that we can do, and there's a few things I can do to try and work out what the best approach with this is. Now, who do you go to for help? There are people there for us when we feel uncertain. Whether it's specialists, whether it's picking the phone up to a registrar or a consultant, whether it's writing a letter to someone for a bit of advice here. Whether it's speaking to someone in a certain department about pensions or benefits or bus passes, or looking at the DVLA guidance, honesty is always best, and saying, you know what, I'm not quite sure here. I've got a fair idea as to what's going on, but you know what, let me just double check that and maybe get back to you. That's much better than someone saying, oh, I think it's this, and kind of pretending that you know what you're talking about, blagging your way through a situation. It shows, it's so obvious. Anyone watching you will know that this is someone who is guessing their way through a management plan. Now that might be medical, in which case that's a safety issue. Are you really going to prescribe something that you're not 100% about? Or it could be something completely non-medical where you're giving really, really key advice to a patient. Something about a genetic clinic. What do they do, for example? Or looking at whether I'm allowed to drive or fit to fly with this problem or not. Don't guess your way through these things. Make it clear that, look, I don't know this inside out, but I'm going to find out for you. But I'm pretty sure perhaps that it's okay or not okay, or whatever you're thinking. Don't blag your way through. Don't guess it, because if you start doing that, the first doubt that creeps in is this what you do in real life? Do you just blag your way through and pretend to show to patients that you know what you're talking about when clearly inside your mind it's telling you that you don't? So when it comes to uncertainty, honesty is so important. Don't worry that it looks silly, that you really think that you should know this. Just be clear. Sometimes there may be a non-specific set of symptoms. You may not supposed to know what the actual diagnosis is, and don't get sucked in and kind of guess what. This could be a few things going on here. I'm not quite sure. There's a few things going through my mind. Perhaps it could be this, or this. Let's see what we can do to make this a little bit more certain. And know who to go to for help. As GPs, we have a phone right in front of us. We have access to email in front of us. We can speak to colleagues who might know this a little bit better than us. Always use your resources to deal with that uncertainty, because it's certainly okay to have it. So secondly, we can talk about is focus on what you do know, or focus on what you are certain about. Now, there's going to be a whole load of things going on in a case. There's medical stuff, as you know from our previous videos, there's psychosocial stuff, eye stuff's going on, stuff in the patient's mind, stuff in the patient's life. Now, you can be certain about certain things in a case, even if you're not certain about every single thing going on. Say, for example, someone comes in with a vague set of symptoms. You've done a few questions medically, you've ruled out serious stuff, but you're not quite sure what's going on. Now, our mind tends to make us worry about what is the diagnosis, and we put all our focus towards that, and we can actually neglect some of the more simple things, like talking about how it's affecting their job or their home, or whether they're doing certain habits that can make this kind of thing worse, or what their fears are, or what actually is going on in their mind beneath all of these symptoms. We neglect all that stuff because our mind tends to focus on the little bit that we're not sure about. Panic starts to set in. Oh my God, what's the diagnosis? If I don't know the diagnosis, how am I going to manage this problem? And actually, before you know it, you spend a lot of time asking stuff about things that really you're trying to clarify, things that you're never going to be able to clarify in the first place. And then you jump into management, and then you again start talking about that same thing that you're not certain about, and it shows, and you get panicky, and you leave the case thinking, I didn't really do very much there. Remember, there's so much that goes on in data gathering, and there may be elements that you're certain about and elements that you're not certain about. But remember, even if you manage the bits that you are certain about, you're still showing that you're managing a situation. If someone comes in, don't forget your psychosocial stuff. Don't forget your eye stuff. Again, human nature will take us away from the stuff that we know and focus on what we don't. But if you get those things out, if you realize there are issues going on at work, if you realize that they're worried about cancer, for example, or if you realize that they wanted a CT scan, you can still deal with those things with a bit of certainty in the second half. And sometimes, if you start the second half by dealing with things that you are certain about, then actually the confidence can take you through, and you'll realize that the bits that I wasn't quite certain about actually make a little bit more sense now, and you can tie it all together in management. Now, the third thing I want to talk about is the power of reassurance in uncertainty, both for us and for the patient as well. Now, say for example, you don't quite know what a diagnosis is. Say for example, you know what a diagnosis is, but you don't know what the management plan is or what particular drug you're supposed to use. If you start talking in a very uncertain way, it's going to show, and the patient's going to get really worried that the doctor's not quite sure what's going on here. But there are certain things that you can reassure a patient about. If you have ruled out significant pathology, if you've done your red flags correctly, if you've examined the patient really well, for example, you can be open and say, you know what, I'm not quite sure exactly what is going on here, but I'm pretty confident there's nothing worrying or serious going on here from what I've talked and examined you on today. That's a really powerful thing, and actually it helps you feel a little more confident about what you're talking about. Reassure the patient about it. If you're in a management plan, if you think, okay, is it this drug or is it this drug? Is it a referral yes, referral no? Does the guidance say this path or this path? Just reassure them what you do know. Say to the patient, look, we're pretty sure that this is what's going on. If this is a treatable condition, there are medications out there that can help with your symptoms, help with your problems. I'm just not quite sure which one we're going to go for yet, but I just wanted to let you know that we can treat this problem. That goes a huge way to relieving anxiety in a patient. But if you act uncertain yourself and kind of look a little bit edgy that, I'm not quite sure what to do yet, and it shows, they will walk out uncertain, worried and fearful, probably more than when they came in the first place. So reassurance is key. You can always reassure on certain things. You can reassure that you will find out the answer to this. You can reassure there's nothing worrying going on. You can reassure this is not something like a cancer, and use that tactic quite a lot because it takes away their uncertainty, but also more importantly, it helps deal with our own uncertainty as well. So guys, I hope that video is of some value to you. Look, uncertainty is going to happen. It's going to happen in real life. It's going to happen in the CSA as well. And there's a few things that you can do just to help yourself out a little bit. Remember, be honest. Yeah, nothing's more powerful than being honest to someone and being open about what you're certain about and what you're not certain about. And don't forget to go to people for help. That's why they're there. We can turn to people when we need to. Number 2, don't forget to focus on the areas that you are certain about. Yes, there may be a few little things that you're not quite sure about, but there's a whole load of stuff that I'm sure you are certain about, and focusing on those is really, really important as well. And number 3, don't forget the power of reassurance. Reassuring certain things that you are certain about goes a long way to dealing with those little bits that you're not certain about. I hope it's been of value. We do try and produce videos once or twice a month, so if you found it useful, please check out our other videos. Please subscribe to the channel if you think it was some value to you. If you have any suggestions for any new videos, both for AKT, CSA, or any forms of GP training, please get in touch. Our details should be down below. Hopefully we'll get to meet some of you guys at our courses going forward. Take care.